Hello, and welcome to the Racial Equity Webinar Series. I'm Amelia Smythe-Seeger, Deputy Director at USBC, and I'm so glad to have you join us for this session. The United States Breastfeeding Committee hosts this series of bi-monthly webinars as part of its efforts to create and model a culture of inclusion, diversity, and equity. With funding support from the W.K. Kellogg Foundation, this series will focus on building the capacity of the breastfeeding field to apply both an equity lens to inform and guide our external strategies and activities, but also an equity mirror to examine our internal structures, culture, and policies. Webinars are typically held every 2 months in odd-numbered months on the fourth Tuesday of the month from 2 to 3:30 p.m. Eastern Time. We're so glad that everyone was able to adjust with us and our speaker today on this rescheduled webinar. Access to these webinars is free and open to all Breastfeeding Coalition leaders, members, breastfeeding advocates, and to anyone involved in forming or leading nonprofit organizations in the breastfeeding field. Webinar and registration details are posted before the live session on our public webpage at www.usbreastfeeding.org/equity-community. We've streamlined access to this series, so you only need to register once to have access to all future sessions. Once you've registered, you'll receive reminders from the GoToWebinar system with your unique link to each session. Slides for today's session can be found on the Racial Equity Community webpage and has been chatted to you. We understand that not everyone will make it to our live sessions, so we do record all of our webinars. You'll be able to find the recording of today's session on the webpage or in the Coalition's Learning Connection, along with our other archived sessions. For today's session, all participants are in listen-only mode. We have set aside 10 to 15 minutes after the presentation to answer any questions you may have for the presenter and encourage you to type in your questions during the webinar. Next slide. And here is how you do it. Go to the GoToWebinar control panel on the right of your screen. If you don't see it, it may be minimized. Click on the orange tab and it will pop back out. If you scroll down below the audio section, you will see a tab for questions. When you click on it, it will open up a box for you to type in. If you have any webinar-related problems, please send an email to coalitions@usbreastfeeding.org and one of our staff members will assist you. And that brings me to today's topic. Envisioning a Breastfeeding-Friendly System 2.0. Envisioning a Breastfeeding-Friendly System 2.0 is a solution-driven presentation designed to tackle breastfeeding inequities at both a public and private institutional level. Join the USBC in this presentation that will explore the key elements of a breastfeeding-friendly system. A breastfeeding-friendly system is one where, number one, the community voice is honored. 2, the policies, attitudes, and practices align to achieve racial equity in breastfeeding. And 3, the institutions and agents of institutions demonstrate accountability to the community for their acts and behaviors. Today's learning objectives include 4 different aims. First, to be able to name the elements of a breastfeeding-friendly system. Number 2, state the ways to amplify the voices of Black mothers through community leadership, community integration, and civic engagement. Number 3, identify the policies, practices, and attitudes that align to achieve racial and health equity in breastfeeding. And number 4, list the actions that show accountability to the community. And next slide. That brings me to today's presenter, Kidada Green. Kidada Green is an internationally renowned thought leader. As a founding executive director of Black Mothers Breastfeeding Association, she purposefully uses her platform to reduce racial inequities in breastfeeding support for Black families. Ms. Green's innovations in the field are immense. She is responsible for spearheading the formation of the Black Breastfeeding Caucus and co-creating the Mommy-Friendly Detroit and Black Breastfeeding Week. As an expert in community-centered approaches, she put forth recommendations for the U.S. Surgeon General's call to action to support breastfeeding. Ms. Green is also an esteemed member of the inaugural class of the W.K. Kellogg Foundation's Community Leadership Network Fellowship Program. She holds a bachelor's degree from Michigan State University and a master's degree in the art of teaching from Oakland University. She's a devoted wife, mother, and educator. And it's so wonderful to have you with us today, Kadada. With that, we'll turn it over to you.
Well, good afternoon or good morning, depending where you are in the world. I am very happy to be here. I want to first thank the USBC for inviting me to do this webinar. It has been a few years since I've done a webinar for the USBC, so I'm happy to be back. And I'm really happy that over the course of time that the field has grown and that there is more, what I think accessible information and knowledge around what it means for racial inequity and breastfeeding support for Black families. So I'm honored to be here amongst colleagues around the nation who are really vested in the work, amongst colleagues who understand that the health and well-being of any community is directly related to the health and well-being of the mothers and babies in that community. So again, thank you all for inviting me. I appreciate the warm welcome and the introduction. I'm grateful to have been doing this work for over 12 years in Detroit, Michigan, as well as nationally. The beauty of doing this work for so long and so broadly is the number of times that I've bumped my head, the number of lessons that I've learned, the successes and the challenges. One of the most important things that I can tell you is that the work must be done collaboratively. No one person, no one group, no one organization can do this alone. And with that being said, let's see who are, let's continue on with this work and approach it with the collaborative spirit. So really, what's the big deal about breastfeeding? These are things that most of you on the call may know, but I think it's really important for me to really approach it in a way where we're looking at babies, families, and communities. So sometimes we often think of the baby as the big deal, but there's so much involved in breastfeeding that it affects more than just the baby. But definitely babies win. There's a reduction in the chances of sudden infant death syndrome. It's critically
Sorry,
important.
just one
Hi.
second. It looks like your screen might be zoomed in. Um, we're seeing just a reduced version of your slides.
Let me see how I can approach this. Hold on. I'll try something different here. Does that help?
That does help a lot.
Oh, okay, wait, and then it went back. But you can see the slides. Okay, I see you there. So it's
Can you move that
critically
back to where it
where it
was before you
was.
paused it? Yeah,
Okay, that's
all the
better.
way at the corner, if you can.
Okay, no problem.
That's it.
Oh, then it did that. Okay, here we go. Thank
There we go.
you.
Thank you.
Yep, so this is critically important for premature infants. Breast milk is rich in nutrients and antibodies. It enhances brain development, fights diseases and infection, and is easy to digest, amongst other great benefits. In addition to babies winning, families thrive because breastfeeding is convenient. It satisfies the baby immediately. It keeps families close, secure, warm, and comforted, and it helps mommy with postpartum weight. There are other many great health benefits to mommy, and overall, the price is right because it's free. Communities are vibrant. Here you're looking at a picture from a Black Breastfeeding Week event that we had in Detroit, Michigan. And as you can see, we are lifting our every baby. We're lifting our babies to the highest pinnacle. And it's really important that we understand that breastfeeding supports the community. It saves lives, making communities thrive. There are fewer absences from work and from childcare, reductions in healthcare costs, and it's environmentally safe. So now that we've gone through that, let's dig more into what it looks like to envision a breastfeeding friendly system. There's several elements that we'll be uncovering that are involved in creating a breastfeeding friendly system. The most important element in building the system is community. Think about it. How do you involve your target community in your plans and decisions and leadership? Here's a billboard that is placed throughout a few neighborhoods in Detroit. The billboard is highlighting things that are important to the community, and the mothers of the community are featured here in the billboard alongside Councilman Scott Benson. So, as we're going through this presentation, I want you to think of ways that you can publicly display your support of breastfeeding, but doing it as thinking of it as community led. These are things that our families have found important, and we were able to have those things uplifted by our councilman. In order to impact folks, you really have to hear them. Their voices must be amplified. It must be resounding and vibrant every step of the way. There are many ways to include the voice of the community into repairing the system. Listed here are some examples. One is creating and distributing surveys. For example, during our breastfeeding clubs, we have post surveys that pop up as part of our system when families return and they sign in. Another way is to facilitate focus groups where you're intentional about gaining information that really digs deeper into the experiences of the families and the rationales for their decisions made. Additionally, there are media requests. When journalists reach out to you for a media request, who's being quoted? Is it the organization leader? Is that the only voice that's being heard, or do we take the time to allow the families of the families of the organizations that we're servicing to be quoted and have their voices uplifted during those media request opportunities? Host listening sessions. So who's listening and why? Think about who writes the questions, who takes the notes, and is there reciprocity? And what does the community have to gain from participating? So let me go back a little bit. When I ask, when you're doing listening sessions, what is it that you're trying to discover? Who is it that is actually writing the questions? Do the questions resonate with the families that are serviced? Families should be a part of writing the questions to gather information from the listening sessions. And who's taking the notes? Is the note taker of and from the community? It's very critical and it's very important to think about how what is being said is actually making it to paper, because sometimes the tone, the inflection, the cadence in the voice represents a meaning that may be different to each listener. But if it comes from someone of a similar socio-cultural background, then they're more likely to capture that meaning. There's a rhythmic in the flow of the tone. There's a cadence that's important when we're conveying messages. It's it's important to know that an interpreter or someone who's writing a message is making a good guess if they're not one who's familiar with the tone and the cadence and the rhythm and the flow of the audience who's speaking. And also think about reciprocity. When I say reciprocity, what does the community have to gain from participating in the listening session? Is it the gift card that they receive when they arrive? Well, certainly people should be rewarded for their experiential knowledge and for giving information, but we really want to dig deeper. Is what you're doing with the listening session, what you're learning, going to come back and have a positive impact on the families who are being served? There has to be a give and take. If you want to be allowed or to participate or to be part of a community, you really have to think about the reciprocity involved in that. And it has to go beyond giving out an incentive. You have to be willing to report back. You have to be willing to use the information and the knowledge gained to really service and help the families that you're listening to. Those are really good things to keep in mind. Um, what the community has to gain from participating, and it must go beyond a small incentive. It really has to dig deep into how you're going to impact birth outcomes, how you're going to impact breastfeeding outcomes by this information that you're receiving. Also listed here is stakeholders meetings. Host stakeholders meetings where the voice of the community is centered. Not only centered, but really entrenched into the fine details of the agenda. And the way to make sure that the voice of the community is entrenched into the fine details of the agenda is to make sure that they are a part of creating the agenda. So you don't want to show up in someone's space and say, here, we're going to do A, B, C, and D. The community should really be a part of creating the agenda of what it will look like, what time it will start, when will it be there, what's the objective, what are the goals, what are the questions, how are we going to situate folks? Does it make sense for this group of people to sit together? Or does it make sense for this group of people to sit together? Those are really important things to know. Excuse me, because that's how you're going to get the most out of what you're doing. Your most valuable stakeholder really is the population directly affected by your service. You really need to treat them like a valuable and a rare gem when working and hosting stakeholders meetings in the community. Additionally listed here is gathering narratives and telling unaltered stories. It's really important that we tell unaltered stories. Now, I know sometimes you're gathering narratives, you're doing a vlog or you're showing a video and time is of the essence. It's really, that's understandable. However, you don't want to clip or edit out the content or the meaning of what the person is trying to get across. There's so many ways to to create and collect narratives. Some groups or organizations use blogs, some use vlogs, or they use an interview technique. It's important to let folks tell their own stories. And really, when you're talking about editing and cutting things out, you got to understand the purpose of why you might be doing that. Is it for the comfort of others? And I say that because I recently participated in the grand rounds, and I played a testimonial or video from a mother who was receiving our doula services. And during the grand rounds, of course, there were doctors present, and that was my audience at the time. However, I was aware that she had said something in her testimonial or in her patient story that doctors may not have been happy with. However, I thought to myself, if this 5 minutes is going to make doctors feel uncomfortable, think about what it feels like for a Black woman to be dishonored during her time in that session with the doctor, during that time in her pregnancy. Think about what it feels like to go through your pregnancy, to go through your life, to be dishonored as a Black woman. And I erred on the side of it's most important that the folks here in this audience understand the experience, and that had to be unaltered. And it had to come from the family, it had to come from the mother. So if you're sharing your story with a group of providers and you believe that the storyteller has said or written something that may offend the provider or their practice, don't edit the message. If the provider is uncomfortable for just a minute, just try to imagine how it feels having your motherhood dishonored. It's much more of an intense feeling than discomfort. Additionally, do not be a fly on the wall. We know that you're there, we hear the buzzing, and we feel the presence. Do not show up in Black only spaces just to listen. Do not make a so-called well-intended visit or request to be in Black only spaces. It's really offensive and insulting. If you choose to disregard this advice and make the request anyhow and get rejected, do not expect the host or the leaders of that space to refer you to another source. It's really important that if you know that the space is a Black only space, that you honor that. Because if you're coming to get information, there's so many other ways that I've listed here for you to get information to feed your work, that is not intrusive. And considering that you may not get the information you've intended to get, because once you enter that space, it really changes the dynamics anyhow. So it's very important that you honor Black only spaces. Being a fly on the wall may cause undue stress to Black families, to Black people, and you just still won't get the information that you desire because we may not be as transparent with you present. Doing so, we understand that you look more like a spy and not a fly. So please, please honor Black space, Black only spaces. Again, who in your department or organization is responding to media requests? Whose voice is really being amplified? This is an article that was run during Black Breastfeeding Week. When Rewire News requested an interview, we immediately turned to our mommy ambassadors, letting the quotes come directly from target families. So again, it's important to make sure that you're amplifying the voice of the community. There's so many ways to do that, and here is just one. Let's look a little closer at stakeholders meeting. This was a stakeholders meeting that we had some time ago. And during the meeting, we reported out to our stakeholders. We solicited more from them. We wanted to know what else they wanted from us for us to report on or for us to share as we move forward. And there's a powerful panel here from left to right. There on the right picture, there are two of our community-based doulas, two of our program participants, and one with child. They discussed their experiences in the program very candidly with other stakeholders so that we could look at our successes, we could look at our challenges, we could hear and know what else it is that we deserve, that our community deserves to hear from us. Again, when we're talking about personal narratives, let the quotes come directly from target families. There's no need to write someone's biography when they're open and willing to write their autobiography. Perspective is key to storytelling. Remember, there are 3 points of views when telling a story. Second person is used when you're speaking directly to the reader or listener, giving them instructions, telling them what to do, preaching to them, or giving a speech. Who knows? That might work with your staff when enforcing policies, but for storytelling, I remain unconvinced. Third person point of view is when you're an external voice telling someone else's story. Now, you tell me what point of view is most powerful when amplifying the voice of the community. Do you want to hear from the community members or do you want hearsay? Which by definition is not one's own direct knowledge. It allows first person, which is often used in narratives and autobiographies, allows the person to tell their own story and speak their own truth. The storyteller uses their own point of view to describe their life experiences. First person is really the preferred method when amplifying the voice of the community by way of storytelling. In 2016, as you know, or as you may know, Black Mothers Breastfeeding Association, we have a platform. We have our website. We were building our blog series at the time, and we saw this as an opportunity to share the narratives of two families and their experiences while pregnant and parenting through the Flint water crisis, a crisis that's actually still impacting families today and will forever impact families. And so this was our opportunity to hear point of views directly, using the family's direct knowledge and experience. Remember, perspective is key. So we were able to, we had two families to really share about their experiences with pregnancy and breastfeeding. The blog is actually still there if you want to read it. But in a time when there's so much going on and there's so much need, we wanted to use it as an opportunity to amplify the voices of the community through their own personal narratives. Who are the leaders in your community? Who is respected? And who are folks looking to for support and advice? Think about who it is that wants to do more, but may need to be invited. They just might need a little nudge sometime. How do you utilize the leaders in the community? How are leaders used to set agendas, to reach goals, to set goals? The leaders are the people who understand the struggles of Black mothers and Black babies from their own experiences, as well as the experiences of others who come from a similar sociocultural background. Lived experience and experiential knowledge are key factors in creating a breastfeeding-friendly system. Pictured here are two of our mommy ambassadors for Black Mothers Breastfeeding Association, Malika Gardner and Victoria Washington. They really lead the vision for the Mommy Ambassador program that we have. Our Mommy Ambassadors are a group of mommies who represent BENFA publicly, but also as well as within our groups that we have. They speak on behalf of the organization to various audiences, and their voices are amplified to inform or to help shape institutional, local, and state policies and practices. Community integration. When you think of a maternity care team, who comes to mind first? Did you think of the nurses or the doctors or the midwives? To fill the void that exists when patients leave or arrive to the hospital or the clinic or the doctor's office, let's begin to think about who are the critical members of the maternity care team. The team should include community-based doulas, community health workers, community-based breastfeeding peer counselors, and peer educators. These members' contributions to successful birth outcomes are invaluable. Their full contributions are made most evident when valued with compensation, supervision, and support. The services that they provide to fill the void or gap that occurs when mothers are in their home environment is critical to the success of the breastfeeding experience. Home visiting community-based doulas and breastfeeding peer counselors and community health workers and breastfeeding clubs that are in the community are built of those folks who are intimately connected to that space. They're the folks who live, worship, shop, play, attend school in the community. Improved breastfeeding rates, birth outcomes, and maternal health demands go beyond the doors of the hospital. People have to be healthy at home with their loved ones. Intentional community integration into healthcare practices also requires that you remove barriers to peer support. One institutional barrier that often exists at many hospitals that must be removed is the practice of considering community-based doulas as a visitor. Community-based doulas must be referred to as a member or a complementary part of the maternity care team. They are present to work, giving non-clinical, one-to-one continuous care to laboring mothers. Community-based doulas are not present for a hospital visit. They are there working on behalf of the laboring patient. We must now discontinue forcing mothers to choose between having her family present or her doula present. Doing so invalidates her birth plan and dishonors Black motherhood. If a mother is allowed a limited number of visitors to her room and one of them has to be the community-based doula, it's really insulting and disrespectful to her as a birthing mother. It's critical that community-based doulas not count towards the number of visitors who are present in the room. Pictured at the top here is one of our mommies nursing her beautiful baby, sitting beside one of our previous community-based doulas. Below are our partners at Henry Ford Hospital in Detroit with their administrative leader, Dr. Wisdom, community health workers, and their patients are celebrating a new life of a healthy newborn baby. To change systems, we have to change policies at the public and private levels. It's our duty to also engage business owners and policymakers. This level of cross-sector engagement is a critical element to creating a breastfeeding-friendly system. Here are a few examples of ways that policymakers have been engaged in Michigan and in the city of Detroit. In August of 2018, the governor declares August as Breastfeeding Awareness Month in Michigan. It states that supporters of this effort, to include hospitals, WIC agencies, community stakeholders, coalitions, physicians, and the Michigan Department of Health and Human Services, with the goal of increasing breastfeeding initiation and duration rates, healthier mothers, healthier babies, and closer families. As part of the proclamation, the governor stated that Michigan is committed to reducing infant mortality and increasing the health of mothers and babies. The declaration speaks to the values of not just the state of Michigan, but to the supporters that made it happen. Our government officials are put in place by us, and we need to hold them accountable to uphold our values. However, we have to use our voices and collaborative force to make sure that policymakers know what is important to us. In Detroit, the mayor wrote a proclamation to recognize and celebrate Black Breastfeeding Week. He dedicated the last week of August as Black Breastfeeding Week in the city of Detroit. This effort was in response to the urging of advocates and city council members in the city of Detroit. This is a huge feat that speaks volumes. Not only does it show that the city of Detroit values Black families by this coming from the mayor, it gives others permission to recognize and uplift the importance of Black breastfeeding experience. It speaks volumes to those who are otherwise not willing to take a stance on the concerns of Black families, even when data shows us that we need to have a targeted, accelerated approach to addressing infant mortality rates of Black babies. It helps that a government leader makes a broad statement, but be clear that this was in response to civic engagement. The voice of the community matters most. So we were really grateful when this happened in Detroit, because it allowed us to really amplify and celebrate Black Breastfeeding Week. As you can see there, Black Breastfeeding Week is coming soon. It's the same week every year. I believe we're moving into our 8th year of celebration. I may be losing count. I think it's the 8th year. Hope it's not the ninth. We're moving into our 8th year celebration, and we're celebrating August 25th through August 31st. We're currently accepting submissions for folks who are interested in helping us to build the theme for the 2020 celebration. So if you're interested, check out the Black Breastfeeding Week Facebook page because the submission time closes March 6th. So take an opportunity to let your voice be heard in the national celebration of Black Breastfeeding Week. On the right, what you see here is a State of Michigan Certificate of Proclamation that was signed by our current governor. So previously, I showed you what our former governor had signed in 2018, which was the celebration of August as National National Breastfeeding Awareness Month. What we have here in 2019 is our current governor who said, "Hey, we're going to celebrate Black Breastfeeding Week on the state level." This was a really critical move because the governor signed this along with the support from the Michigan Department of Health and Human Services. Our organization worked with Michigan Department of Health and Human Services to get this proclamation in front of the governor. And this is what civic engagement looks like. I know civic engagement, what it looks like, has changed over the years. Many may still consider civic engagement is just us going to the ballots and casting our vote, but there's so many ways to have your voice heard. And so what we did was we really worked with the Department of Health and Human Services here in Michigan to create this proclamation and submit it to our governor for consideration of signing. And we were so very thrilled that she did. Along with this, there was a huge press release that was sent out. The proclamation, you can Google it if you want, it's available for folks to see. But what it does is it really uplifts the importance of Black Breastfeeding Week and why the governor sees it as something that we should be celebrating throughout the nation. And with the support of the Michigan Department of Health and Human Services, it says to folks in public health, whether at a state level, at a local level, at a county level, that this is something that we value. So get on board. And from this, we noticed that we had additional people celebrating Black Breastfeeding Week in Michigan who had not previously celebrated Black Breastfeeding Week. So this was really, again, an act of being civically engaged and uplifting the needs and the voices and the wants of the community. So we still have time, you guys. There's time for you all to work with your local government, your policymakers at a city level, at a county level, and at a state level towards getting a proclamation signed for Black Breastfeeding Week. And again, if you'd like to get your submissions in for the theme of this 2020 Black Breastfeeding Week, check out our Facebook page. We welcome it. Between the years of 2014 and 2017, I worked with one of my friends and colleagues, Kimberly Seals Allers, on a project that she led. It's her brainchild. It's called the First Food Friendly Community Initiative, or 3FCI for short. 3FCI was piloted in neighborhoods of Detroit and Philadelphia using a community partner model to transform communities into spaces that are welcoming and friendly to breastfeeding mothers. The project was driven by community members. The first step, as you can see there, in this initiative involved engaging the community. We walked door to door and posted ourselves at highly frequented neighborhood businesses like the grocery stores. We surveyed and asked community members about their needs and their desires for their families. But we didn't just stop with their needs. We were able to really assess their values and really look at it from a positive lens, thinking about the assets that they bring there. So with that, we were able to understand available resources and sentiments, while identifying the assets, we were also to identify gaps. And so from there, we moved into step two of the initiative. This is where I played a major role, writing an adaptable curriculum to address the needs of the community. The curriculum boasts an introductory section and 7 modules focusing on community touchpoints such as indoor, outdoor recreations, restaurants, daycare centers, and churches. Community members were trained with this curriculum using a framework that is inclusive of their lived experiences in their neighborhoods. Step 3 involved a short-term paid internship for trained mothers. Here we partner with local workforce development agencies to support the interns implementing the curriculum. The interns went to local businesses to influence their policies as it relates to supporting breastfeeding mothers. Step 4 of the pilot initiative is recognition and reward for those businesses who supported the work by changing their policies to support breastfeeding mothers. In the Osborne neighborhood of Detroit, interns visited a total of 46 businesses or venues. 25 agreed to support 3FCI by signing a letter of support. Additionally, 20 displayed the 3FCI decal in their establishment. 5 of these businesses designated space within their facilities to allow mothers to breastfeed, and 3 agreed to display their 3FCI certificate. In the Strawberry Mansion neighborhood of Philadelphia, 16 venues agreed to support 3FCI by signing a letter of support. All of these sites agreed to display their 3FCI decal, and one went further. They agreed to adopt a worksite policy to support breastfeeding mothers. The interns also helped a church and a daycare begin the process of accommodating nursing mothers by providing a comfortable space for her to nurse her infant. Because we know that breastfeeding mothers deserve support where they eat, play, work, and worship. And so 3FCI really helped in the aim of transforming the local landscape for mothers and babies by engaging elements of the community, actually integrating the community's needs, wants, building on the assets that were there is really key to why this was successful. And by working with the community members and the residents, we really were able to start shifting the environment and transforming the landscapes of mothers. And that's really critical because, as you can recall from the beginning, this all started with engaging the community and the family. So really embracing what these communities desire and what they need, or what our communities desire and what we need. Another important element of a breastfeeding friendly system is honorable policies, practices, and attitudes. My culminating project of the W.K. Kellogg Foundation's Community Leadership Network Fellowship is Mommy Friendly Detroit. In partnership with my colleagues and in leadership with them, Jay Clement, Mommy Friendly Detroit is really her brainchild, and Valerie Jiggets, we sought to make motherhood for Black women an honorable experiences. The premise for the project is that the baby is not well if the mother is not well. We also believe that it is a direct disruption of racism to celebrate and honor Black motherhood. I'm going to let that sink in a little. I'll say it one more time so that it could sink in. It is a direct disruption of racism to celebrate and honor Black motherhood. How do we make this tangible? So let's look at policies. There are ways to do this. Again, the maternity care team, I really want to emphasize rethinking who we consider as part of the maternity care team. I gotta pause because I that's my baby there on the screen. I really have to mention that. That's my baby Lala. She's 8 now, but that's a throwback picture. So if you see Lala, you see me because she's an image of me. And I'm really proud of that. Okay, mommy, back on track here. So really, let's emphasize who we consider part of the maternity care team. Ensure that community-based doulas are also considered a part of or complementary to this team, removing the requirement that counts community-based doulas as a visitor during the time that the mother is laboring. Flexible work schedules. The hustle and bustle of motherhood is real. Work flexibility leads to improved health care, preventative care, and extended breastfeeding. Some examples may include gap scheduling, working from home, bringing kids to work, or allowing for staff to flex out time amongst one another. I know that I'm preaching. I know that the USBC and a lot of you here really understand the importance of paid maternity leave or really paid parental leave. This is the first step in really supporting us as super moms. Investing and working in both the private sphere of the home and the public sphere of work is a way of supporting mothers. Mothers and families are so often left to do patchwork to create their own paid leave, which oftentimes leaves them without future sick days or vacation days they may need down the road. Even more devastating are even more devastating are the many families that have no paid time through their employers. These families are really forced to take unpaid time from work or worse, return to work only days to week after giving birth. It's critical for long-term breastfeeding success that mothers be allowed the time needed with her new baby to establish healthy feeding behaviors. We need time to heal and bond with our babies, which is essential for family health and the health of our nation. Earn paid sick time. Employers, listen to me, employees get sick. Employers, listen to me, employees' children and family members get sick. Let's not make getting sick a punitive action. Paid sick time is a thing that can be made into a reality in the workplace. Child care centers must also adopt policies for milk storage and handling. For many moms, the need to return to work or school and be separated from their babies can make it challenging to continue breastfeeding. Some mothers won't even initiate breastfeeding because they know they have to return to work and they don't have the support of a child care center who understands milk handling and storage. The support of our child care centers is key. More and more families are looking for child care centers that have policies in place to handle breast milk. So not only is it a critical for the baby's health, it's a great marketing strategy. It's also nice and important to have trained lactation specialists available. This is a big one for us, especially here at Black Mothers Breastfeeding Association, because we've really been working hard to sustain our community-based doula program. Medicaid reimbursement for peers, community-based doulas, and community health workers and other lactation specialists is really critical for help is a really critical policy that's needed for helping families to have good birth outcomes. We work so hard to sustain programs and services, and Medicaid reimbursement can really help us to build a reliable workforce for these fields. I want you to think of some of the policies that you might add to this list. These are just some of my pet peeves here. Practices. Again, we're talking about policies, practices, and attitudes. Ongoing professional development with an emphasis on racial equity, cultural sensitivity, and culturally appropriate care. I know that you folks who are on this webinar, you get that. That's why you're here. So I appreciate you being here. I also want you to know that this is a really tangible way of learning how to impact Black motherhood and how to honor Black motherhood by taking advantages of these opportunities. If you're in a position of power, it's important to make these opportunities available to your staff. Also, during practices, we really have to acknowledge present fathers. So many times I hear, oh, fathers aren't present. Oh, the father didn't come. The father this, the father that. And when the father is there, the fathers often sit there with little recognition. So if a father is present, make sure that he's recognized and included in the conversation. That's really key. That's a key part of someone's practice that could make the difference in healthy birth outcomes. Also, it seems simple, but we hear lots of stories of folks just having poor bedside manners. I mean, I know when folks go to work, you're saying this is something you do all the time, but these are experiences for the families that you're serving. This is not something that they do all the time. So really treat them special. Again, treat them like the gems that they are. Honor honor the mother's time. To have someone waiting in the waiting room for hours is really dishonorable. That's no way of respecting a Black motherhood. It really isn't. I mean, take the time to do the assessments, learn how much time folks are really spending in your waiting rooms, and think about how you might improve upon that. How can you schedule better? What would that look like for you? Take those times to improve your practices. Families have birthing plans. Honor the birthing plan. Now, I get it. I know that sometimes there's this dream birth and it all can't happen the way that mother intends for it to happen. But so many times there are things that a mother has put in her birthing plan that can happen that because of lack of honorable practices providers disregard the birthing plan. So take time and spend with the families before their births and during the birth to understand what the birthing plan is. Offer extended hours. If families work or if mothers have kids in school, then sometimes it's hard to get to a doctor's appointment between 9 to 5 if you work between 9 to 5, especially at the end of the pregnancy when you want folks to come every week. Think about what days you can maybe open late and extend those hours so that there's opportunities for busy or working families. And in your practice, offer breastfeeding support and encouragement for every patient. I know that there's a short amount of time that you have with each patient, but families are there. Families are waiting for you, whether they're waiting in the patient room or whether they're waiting in the lobby. It's important. This is where we build the maternity care team. Take time for those breastfeeding peer counselors. Take time for the community-based doulas or the community health workers to use that time when families are waiting for your care and use that for breastfeeding support and encouragement. There's so much value in the time that folks are waiting. Take advantage of that. And again, that's more ways of adding honor to someone's time to your practices. Check those attitudes. Oh my goodness. In our conversation with Black mothers, one shared her authentic sentiments. She said, acknowledge my life when it comes to my life. What does that mean?
Eric, that really quick. Yeah, I was about to
Yep, I noticed.
say.
In our conversations with Black mothers, we hear this. They feel like they're being disregarded or that they're just a checkbox. So what that means is that it says that I am somebody, so treat me like somebody. And I ask that you treat Black mothers like somebody through your policies, through your practices, and with your attitude, through your attitudes. And so this is one of the things that we kind of created through Mommy Friendly Detroit. There are these cards that are available, and we understand that it's a bilateral, it's two-way communication, right? We know that patients have a duty and a responsibility to treat providers well, and so do providers have that duty and responsibility to treat their patients and their clients well. And so this is just a card that, hey, that patients can leave behind with their families, or on behalf of practices, providers is a quick way to let somebody know that they're valued. This is the front where it says, hey, thank you for coming. And on the back, in the spirit of a Mommy Friendly Detroit, we want you to know how much we appreciate. If someone asks questions, hey, that lets them know you value asking questions. Check that box. If they share stories about their life or things that are impacting their life, great. If they thanked you, if they were on, if the patient was on time, if the patient was honest, or if you just want to add something, these are quick ways to let folks know that they're valued. So there really are tangible ways to affect policies, practices, and behaviors. I'm going to jump into accountability here. So I told you to kind of check yourself, but how do you check yourself? How are you accountable to the families that you service? The mothers whose voices you're amplifying? How are you reporting back to stakeholders? This is honor. This is how we honor Black motherhood. When you ask your families to inform your decision making, they are due a report back of how things are going. And how do you report back to them? Reporting back, having two-way communication is an important part of building relationships and building trust. Or do you just use your families for information? So you can write your report to your funder. So you can check the box on your research that you're doing. Anytime you ask someone for something, you should give something back to them. It's really reciprocal. Value them and hold yourselves accountable. You can also tell who trusts and values your service by the way that they treat and respond to you. Here are some ways to be accountable. Fidelity. Make sure that you're doing what you say you're going to do. What are your measurable outcomes? Are you examining those outcomes? Are you looking at where you started, where you intended to go, how much growth you made? Did you make any growth? How do you document changes in knowledge, behavior, and attitudes? Through self-reporting, observations, surveys, pre and post tests, storytelling, narratives, and attitudes. And what are your checks and balances? Like how do you check yourself? Like how do you show your level of accountability? If you've invited people in to give you information and you write up your report, do you just send that report to your funder? Does it just go back to your university? After you've got people in the door with your incentives, what's next? You really need to think this through. What happens after you get the information that you've needed from them? And then we often set up, often there are folks who set up groups or other activities or experiences for families to attend, and you wonder why there's so few folks there, because we understand that that sometimes you lack accountability and reporting back. Folks don't want to feel used. They don't want to feel like you're just getting them in the door. You just have them there so that you can get your information that you need. Because really, whatever information you're gaining should feed the improvement of birth and breastfeeding outcomes. It's really important that whatever observations and surveys, whatever outcomes you're hoping to have, is because you really approach it with the idea that you're going to impact community, that you're going to improve birth outcomes and breastfeeding outcomes. It's really critical. Accountability is the key. If you feel like you're missing gaps, think about how you've reported back to families and what does that look like. So in closing, you guys might want to get your pen out or your screenshot, because these are the elements of a breastfeeding friendly system that we've gone through and that we've looked at. The first is community voice, leadership, and civic engagement. Next are honorable policies, practices, and attitudes. It's key that you have that part in there about honorable. It's very critical that the policies are honorable, that the practices are honorable, and the attitudes are honorable. And then accountability. What is your accountability? How are you accountable to the families that you service? How are you reporting back to them? Those are the elements of a breastfeeding friendly system. I am here and I am open to questions. Um, again,
Yeah.
thank you for having me. I'm here and open to questions, you guys.
Ah, Kadada, this is Amelia. Thank you so much for this presentation. It's been very rich. And yeah, I think you made a lot of things evident that I think we're aware of on different levels, but you've really called us forth to be conscious in a new kind of way and to be active in a new kind of way. We do have a number of questions and comments. So, first, we really want to take this, the first bullet here that you've highlighted about community voice and leadership and civic engagement. We have a question just a little bit more about how you operationalize that. At the beginning of your talk, you really lifted up how focus group questions and meeting design really needs to be led by the community that you're engaging with. And, we have some questions about how would you recommend going about that? Do you have a subgroup? Do you have, like, how do you get started before you even get to the setting? Can you tell us a little about how you do that?
Yeah, absolutely. So, as some of you may know, we replicate our motto. Our Black Mothers Breastfeeding Club is our motto, and it's open for replication. It's actually been running without interruption for about 12 years now, and it's been replicated in Shreveport, Louisiana, as well as in Gaithersburg, Maryland. And as we set up the design for replication, I really had to use a different lens, a different hat. Because when I started Breastfeeding Club here in Detroit, some things were obvious to me, right? And it was obvious I was a Detroit resident. I had a breastfeeding baby. I'm the person from the community. Like, I'm the community voice, right? And then I also had my co-founders who started the work for me. So some of the things were obvious. But as we opened the model up for replication, I had to think about who would be replicating the breastfeeding club, right? And so it turned out that that the folks who licensed the replication was the Louisiana Health and Hospitals Department, I think it was a FQHC in Maryland. And so that's different, right, than from the actual voice of the community being the person who starts it and does it. And one of the things that we were that I was very insistent on, and that has been a part of our work, is that in the leadership role, so from the time I start conversations with you about Breastfeeding Club and replicating that in your agency, in your community, I need more than half of the people I'm talking to be of that target community. So when I said that to say that when you're operationalizing this and when you're looking at how to make this work, who on the leadership committee, who in advisory, who on the board of directors is actually helping to form and make decisions about things that are happening in the community. And if you don't see the target audience in that leadership role, then that's where you should start.
Awesome. I'm so glad I asked the question. That's really rich. It makes a lot of sense that as soon as you think about how do you move this around and, advise another community to do it that's an unfamiliar one to you, how is it that you go about describing who those leaders are or how to find them? So that's really great. So we have a question that's related to this, related to how you found your mommy ambassadors. We have some questions about, what's that partnership look like? Do you provide, support and coaching to them, or do they really lead it all? Or can you tell us more about what that looks like?
Yeah, absolutely. As so as I mentioned, when I started this, I had a baby. So my baby's now almost 13 years old. I do have an 18-year-old. I'm sorry, not 18, she's 8. She's 8. I have a current 12-year-old and an 8-year-old. So I had to keep in my mind that my experiences when I nursed my baby are becoming, because I stopped nursing her at 2, so they're becoming a little distant, right? I'm honestly not as active in breastfeeding club as I once was, and it was important that we maintain and we keep that leadership going. And so what we did was we started our mommy ambassadors, and honestly we just made it open to folks who were regularly in attendance, who were present, who sometimes people just stand out, right? And so we tapped a few people on the shoulder, but we also just asked folks who wanted to be a part of it. And so if you're looking at mommy ambassadors, you really want to think about who are the natural leaders in the work that you're doing, like who's showing up, who is offering input and insight into what's going on. So I would say start there. Start with those who are naturally engaged and really just taking the time um, to amplify their leadership. I mean, it really wasn't hard for us to identify the mommy ambassadors,
Hmm. Hmm.
but I think part of the question was whose vision is it? Like who's designing the mommy ambassador? So I had the idea, but once I put the idea out there for them, it's totally adaptable and flexible for them to decide what the mommy ambassador program will look like for them, because it has to make sense. It can't just be what could I'm not the mommy ambassador. This is what I
Hmm.
had in mind. But how do you think this will work based on your skill set and your experiences and what you know that our families need? And it's grown from there. And really, Malika and Victoria take the leadership in building that out.
That's so beautiful, Kadada. I love how, then again, as you're building out a model that can be replicated, it's always going to be something that is relevant because it's always going to be emerging right from the heart of the community, which is really cool. I want to circle into something that you also talked about, that's related to this, about how important it is to not edit personal narratives. And I wanted to share, there's a really, I think, powerful story and that I've had permission to share with attribution. So one of our listeners today is Ananka, and she shared this story. She said, I participated in a testimony once, and they edited my story so much that I looked like a bad mom, but the agency looked like the savior, and I was so embarrassed. I think we've seen this
Wow.
happen. Yeah, yeah. I was really grateful that she was willing to share that because I think it really makes your point very real.
Yeah, I appreciate. Thank you for sharing that. It really dishonors Black motherhood. So a lot of what I talked about is honoring Black motherhood. When you take my story and you alter it, you miss again. You miss those rhythms. You miss that cadence. You miss the intent. And so if you want to amplify my voice, it should be amplifying my voice,
Mhm.
not the agency. So many times, and that's where the word kind of token comes from. Folks don't
Mhm.
want to be seen as a token. So the next time you have something and you invite folks out, trust me, the word is out. I'm sure she didn't just share this with us. I'm sure she told others. And now folks don't want to show up to your events. You've lost credibility. And so it's definitely important and valuable that you have unaltered stories. That's really how we value folks, and another way of showing honor to Black motherhood.
Mm. Well, that feeds right in. It was so powerful when you had the slide, talking about the way that honoring Black mothers directly disrupts racism. And, I don't want to miss the opportunity of having you as our speaker, Kadada,
Mhm.
without, diving back into that and say, do you want to say more? Do you want to take a moment and say more about how those things are intertwined and the criticality of disruption to that kind of racism?
Yeah, so this is a deep question, so
Mhm.
I'm gonna try to keep it at a level that's easily understandable. So for so many years, um, from babies have been ripped from Black mothers' arms. I'll say that our milk has been used to nurse white people's babies, and when we couldn't even nurse our own babies. Um, our parenting styles, the way that our interactions and things with our babies has been questioned, and it's really about, I think, when you think about birth and growing this country and what Black women have birthed to life in this country, yet to often, or some people would say always, have it um, dismantled or dishonored, impacts the way that we are viewed as mothers. It impacts not only the way that we're viewed as mothers, but the way that we're treated. So when you honor Black motherhood, when you think about the life that Black mothers have given to not just our babies, but to this country and to other folks' babies, then it really says that, hey, racism, we're devaluing racism. I'll put it that way. If we're honoring Black mothers, we're devaluing racism, and we're showing that the value that Black women have had in this country, from the time that they were brought here.
Mm. That's so powerful. Again, I'm so glad that I asked. And there's a lot of comments in the chat feed, just really, thanking you for those reflections. And people are saying that they're learning a lot from this conversation and from your presentation. I want to make a little bit of a pivot now
Can I
to,
add one thing,
oh
because I
yeah,
want to give
do.
proper credit to that. The
Hmm.
that came out of the work from our Mommy Friendly Detroit work with Jay Clement and Valerie Jig. It's that it's a direct disruption of racism to honor Black motherhood. So if anyone's going to give credit to that, make sure they give it to Mommy Friendly Detroit. Not I didn't. It came out of our work, so it's important that proper credit is given to that.
Awesome. Thank you for that
Mhm.
clarification. So, as we think about, like, you know, this is our shared history, and we've got this shared work we've got to do on how, how are we getting out of here. So a lot of that ends up meaning that, as you said, engagement with policymakers and business leaders is absolutely critical so that we start, making systems level change. So, we have some community leaders who are on the webinar today, who don't have yet established relationships with policymakers. And, it even seems like a little intimidating. So do you have any suggestions about, how to go about starting those kinds of relationships and then sustaining momentum so that civic engagement can really lead to changing things and doing the types of proclamations that you've achieved in your state?
Yeah, well, one, you have to reach out. Try to reach out to them. Many sometimes have coffee and time in the community where they speak with community members. If you're being ignored, I'm just going to tell you, folks have done this to me when I haven't gotten back to the email, tweet them. Um, Policymakers and folks who service you, they don't want to be called out in the public. So I would say, hey, I've tried to reach out to you. I haven't gotten back. It's okay to call them out in the public. So first, just try to reach out to them. You might want to talk to their assistants to see when they have those. They call them cafes or coffees, where they actually have time with folks in the community. If you're not able to participate, or if that's not happening in your space, then it's okay to ask for a meeting with them. They're there to service you. So just take a chance and request a meeting. I mean, we've had folks respond to us who we thought might not have responded. So I would just really say, just try it. It's publicly available information on how to reach them, and if they don't respond, send them a public tweet.
They work for you. All right.
Exactly.
So more specifically, there's some curiosity about, do you know communities that have managed to achieve reimbursement, Medicaid reimbursement for doulas and peer counselors? And if so, do you have any idea, like, how do you get that going? How would one replicate that in another community? Do you know?
So I know here in Michigan, we do not have reimbursement for, excuse me, community-based doulas. I am in a work group, and we are working in that direction. We're working towards that, trying to figure out the process. And here's a great example. I requested a meeting with our Medicaid director because I asked. I said, hey, I want to know directly from you, how is it that constituents influence policies as it relates to Medicaid reimbursement? Because I could do all the guessing and talk to policy advocates, but if we have a Medicaid director, I want to talk directly to you so that I can make sure what we're doing is going in the right direction. But I do know that, and I was just looking at this yesterday, actually, Oregon. Oh, here it is. I actually have it at my fingertips. Give me a second. Health Connect One has an issue brief called Creating Policy for Equitable Doula Access. And so if you are not familiar with it, just Google Health Connect One issue brief, and you'll find their most recent um, policy brief around equitable doula access. But based on the information here, it shows that states that have passed legislation or budgets for Medicaid reimbursement but have not implemented it include Indiana. But states with current Medicaid reimbursement for doulas include Oregon and Minnesota. So that's not to say that these policies that they have or the reimbursements that they have are equitable. It just says that they've kind of made it through the process. I'm familiar enough to know that there's still a lot of work going on in Oregon, or needs to go on in Oregon and Minnesota, to make sure that the reimbursement is really equitable. But Oregon and Minnesota have those policies. And states that have passed legislation but budgeted for Medicaid reimbursement but have not yet implemented include New Jersey and Indiana. And then there's other states who have introduced legislation. But luckily, Health Connect One has created a wonderful issue brief for you if you want to read more about that. It's really a good comprehensive document, and a good place to start to think about what that might look like in your area.
Oh, awesome. And Sarah on our staff put the link for that issue brief right into the chat feed, so everyone can also access that directly. So I think we'll make this the last question of the day. Thank you so much for all your time with this. So, you've mentioned a little bit about having doulas on the care team, and we have a couple questions related to that. Can you give more examples and recommendations of who to include on the maternity care team? And then coupled with that, Can you give an example of how you've handled HIPAA or other insurance issues related, to privacy and who's there, and do those kinds of issues end up ever being a problem you've had to navigate?
So one, I should be clear that we're still working on this in Detroit. So our doulas are, we have had some improvements in attitudes, and in a couple of the hospitals, and also some improvements in practices. But as it relates to policies as doulas, being considered part of or complementary to the maternity care team, we're still working on that. However, I think that that word complementary to might be the
Mhm.
critical phrase for folks who are concerned with HIPAA or insurance, because the doulas are their own entity, so to speak. So those were the words that we were given by leadership and at the particular hospital system. And I believe it may be because of those concerns with HIPAA and so forth, and you not being an agent of the hospital, that we can say, hey, we'll consider you complementary to the maternity care team. But to be a part of the maternity care team, there may be some other layers that we would have to look at. So I
Mm.
would say those are the phrases that we would have to be considering and thinking about when we're looking at HIPAA and insurance policies.
Awesome. Awesome. Well, and so personally, on a personal note, I just want to thank you for those really great mommy friendly Detroit postcards. I love those. I've wondered for years, how is the system going to change when the key stakeholders in the community literally have their arms full of baby, right? And so the
Hmm.
main people that need to be giving the feedback to the hospitals are in some ways, the least likely to be able to do so. So I love that, you've made this so simple and at the same time, that you designed it in a way that promotes your program, but in particular that it really reinforces, gives this really positive message and reinforces the change that you want to see. So that's just, it's brilliant. I was really, really happy to see that.
Well, thank you. And thank you so much for having me. I've enjoyed my experience with you all today.
Yeah, we're so pleased that you could join us, Kadada. So I'm going to now turn it back to USBC staff who are going to share a few important updates. Thank you.
Thank you so much, Amelia. So first up is our next Power Tools webinar is going to be on March 18th. That's only, I believe, 2 weeks away on Wednesday. And the title for that one is going to be Ethical Leadership. What does this mean for my organization? We're going to hear from Lisa Akers, along with some speakers from the Academy of Nutrition and Dietetics, as well as the International Lactation Consultant Association. So please join us on that webinar. We're really excited to have you. And the next update will be with Sarah.
Thanks, Miriam. So as you probably hopefully all know, our conference is coming up in June, and for the first time ever, we are moving to Scottsdale, Arizona. We are very excited that as of this morning, our registration is open, and we'll pop that link in the chat. And we have two different rates just between our USCC members and our non-members. And our hotel booking link is available. And we also have marketing opportunities at our conference, both in person and from a distance. So if you want to exhibit with us, if you want to advertise in our program book, if you want to advertise to our attendees, it's a great way for both for-profit and nonprofit organizations to reach what is a really enthusiastic and excited audience in the first food field.
Wonderful. So again, we have many, many comments in the chat box. Just thanking everybody for this wonderful presentation. And Kadada, I understand that you also have a conference coming up?
Yeah, I do. And I was kicking myself. Can you throw the ball back to me? Because it's on the slide.
Yeah. Let's see here.
Is it showing there?
Um, Not yet.
Okay.
Oh, there we go.
Okay,
Go for it.
great. All right, so we have the second annual Motown Experience Birth and Breastfeeding Conference in Detroit, Michigan, May 13th through 15th. Our registration is currently open at bmbfa.org/conference, and it's there on the bottom of the slide. Before I go into the goals and the objectives of the conference, I want to give you a little bit about the layout of the conference. It's a interesting format. This is our second year doing it. It was so well received last year that I believe it was when we did the evaluations, 97% of the people who took the evaluation said that they were going to come back this year. The other percentage said that they may come back for the second year. So the first day we really open with the Black Breastfeeding Caucus, and that's an afternoon where the caucus comes together and we really talk about our priorities and our action steps. The actual opening of the conference is in the evening, and we will be announcing our celebrity ambassador this week who will be a part of our conference. So I invite you to kind of stay tuned to our website or to our Facebook page for that information. Day two of the conference, we call it the experience because it really is an experience. You get to experience Detroit like you have not experienced it before because it's a maternal child health experience. We take you on a bus tour of maternal child health sites throughout the city. And at each of those locations, you get to hear from program participants and program staff about things that they're doing to impact Black birth and breastfeeding outcomes. And at the close of that tour, we take you to a phenomenal Detroit site. Last year, we went to the Motown Museum, Hitsville, USA. So it's really an impactful experience. And in the evening, we party a little bit, but it's a networking opportunity. We'll call it a networking opportunity with Motown karaoke, and we just have food and we really have a good time. And then on the last day of the conference is really when you have more of your traditional conference with keynotes and plenaries and panels. So really, the early bird registration ends on Friday, and then we'll move into our regular rate. So take time to visit it. But I want to quickly look at the conference goal, which is to align practices, policies. This sounds like what we just talked about, right? Align practices, policies, and attitudes to achieve positive birth and breastfeeding outcomes for Black mothers and babies. And we have a few conference objectives here. We're really looking at father involvement, community-based doula care, those marginalized communities, families that we don't always focus on by destigmatizing care for single moms, teenage moms, impregnant or homeless and pregnant moms, and also some clinical and non-clinical practices. And again, we're always looking to mobilize families, communities, and public and private institutions. So again, check us out on our website at bmbfa.org/conference. Registration is currently open May 13th through the 15th here in Detroit, Michigan. Come experience Motown like you've never done it before, the maternal child health way. Thank you for that.
Are you on mute, Amelia?